So during surgery, what we do is we use a intraoperative GPS navigation type system. So we're very precise and we get excellent accuracy, less than a millimeter. And what we do during the process is we make 2 dime-sized holes into the skull on either side, and under guidance with the navigation system, we insert 2 separate small wires that are flexible. This is what the wires look like. Each of the wires is no more than a couple strands of hair thickness. And what each of them has at the end is a little contact. And these contacts provide a little bit of current. After the first procedure is done, the patients are observed overnight. They go home the next day, and they come back in 4 to 5 days. At that time, what we do is we do another procedure under general anesthesia where we place something called a generator or a battery. This is about the size of a pacemaker, maybe a little bit bigger, but this is placed generally below the collarbone, and we have wires that are extending up into the brain. What this does is it allows power to these wires, and these wires are able to give a little current of electricity to the deep parts of the brain called the basal ganglia, and those are the areas important for movement. I'd also add that the way we're doing surgery at Good Samaritan Hospital is really a generation ahead of how a lot of other centers are doing it. So for Parkinson's disease, for example, we're doing surgeries completely asleep, completely under general anesthesia. Just a couple years ago, patients were required to be awake during surgery, which wasn't easy for the patients. It'd be really uncomfortable. If they had issues with claustrophobia, that would be a problem. If there was a language barrier, that could have been a problem. And the surgeries would really take all day, so the patients would come into the hospital by 5:30 in the morning. Sometimes they wouldn't get done with surgery until about 4 p.m. or so. So at Good Samaritan Hospital, what we're doing it under general anesthesia, so the patients are asleep. We bring in a CAT scanner into the operating room to help with the guidance. We place the wires in, and the surgery is generally done about 3 to 4 hours later, which is significant. And even on the day of surgery, the other way we really differentiate ourselves is we allow patients to take their medications on the day of surgery. And it's really uncomfortable for patients to be off their medications going to surgery or before surgery. So that's another convenience we've been able to offer here by doing it asleep and under general anesthesia.